We're going to take the effleurage techniques now to the back. I'm going to be tucking the towels into the patient's clothing because another purpose of the towels is to protect the clothing from the oils. Some of the oils can stain. Effleurage was to apply the oil evenly across the skin. So I've got my lunge stance, I've got my arrowhead. This time I have got to reach across the bench slightly, so I need to be aware of my spinal posture. And then moving with my hands, same principle of putting the weight into my front leg, moving in and out of a lunge. So reminding you, this was superficial effleurage, applying the oil and getting a feel for the tissues and picking up any inconsistencies or tension or heat that might be present. I can then move to reinforced. I'm going to work on one side of the back, and I'm ensuring that I avoid the spinous processes. So the heel of my hand is on this side of the erector spinae, being reinforced by the top hand. I've slowed it down because I'm putting more pressure on, and I'm moulding to the top of the shoulder. And you can see from the coloration of the skin that I'm having an effect on the circulation already. So this was reinforced effleurage. I can now do knuckle stripping. We didn't use that one on the leg, but it is still another effleurage technique. Contact point is the flat of my knuckles, loose hand, reinforced, sliding slowly up through the tissues, and you can see the depth that this one's now capable of achieving. It will allow me to avoid catching the medial border of the scapula, as my fingers can come together going through the gaps. Sliding back, always maintaining contact with the patient. I can intersperse that slightly deeper movement with superficial effleurage, just on one side of the back. It's my only work area at the moment. I can do finger stripping. And I can sweep it out. And I can do thumb stripping, although it's a little more awkward. So actually my preferred choice here is going to be forearm, because I'm going to get the elbow onto there. Again, avoiding the spinous processes. Resting my spare hand on my arm so that I've got good control, making sure I stay exactly where I need to be. I'll also feel the inferior angle of the scapula there, and that is where I will stop, because I am going to be compressing the ribs and they're going to have very little protection. And I can take it from forearm, as the tissues get warmer, into elbow, and now I will be using my hand as a guide to ensure I stay in the erector spinae. Or bounce off the erector spinae. So I find an area that is tight. I can now focus, heel of hand stripping, another effleurage, keeping my fingers relaxed, on an area that needs attention. And I can now work in a smaller region as I've done a general warm-up. So now I may find that doing thumb stripping will help me identify what's going on. Smaller movements now, but they are still part of the effleurage group because they are longitudinal, going with the tissues. So I have now begun using a light and one of the first techniques that we learn to actually perform a treatment by stretching out the muscles and improving the circulation as I'm going along. That's what massage is, but as you learn more techniques, you're able to select from a greater box of tools the most appropriate techniques to deal with what you found. So this is an example of a treatment using only effleurage techniques on the spine. So now it's your turn, and we need from you now a short clip of your effleurage techniques on the leg, either the back or the front, and we need a short clip of you performing your effleurage techniques on someone's back so that we can look at your posture and your hand positions and you integrating those techniques. Enjoy.